Today, we'll dive into MGUS, monoclonal gammopathy of undetermined significance. It's a condition often found by accident, but it matters because in some people it can lead to serious diseases like multiple myeloma or amyloidosis. Let's break it down, step by step, using the latest medical guidelines. MGUS means your bone marrow is producing a small amount of abnormal protein called an M protein. Here's the key: MGUS itself is not cancer, but it is considered a precursor condition. Most people live normally with it, yet a small percentage progress to serious blood cancers. According to the International Myeloma Working Group and American Society of Hematology guidelines, MGUS is diagnosed when all of the following are true. 1. M protein level in blood is less than 3 grams per deciliter. 2. Bone marrow plasma cells make up less than 10% of marrow. 3. There's no organ damage from the abnormal cells, meaning no high calcium, kidney failure, anemia, or bone lesions. 4. And finally, there's no other blood cancer like multiple myeloma, lymphoma, or amyloidosis. If any of these are missing, doctors consider other conditions like smoldering myeloma. MGUS is common as people age. Around 3 to 4% of adults over 50 have it, and it's usually found by accident during routine blood work. Most people have no symptoms at all. Not everyone with MGUS will get cancer. On average, the risk is about 0.5 to 1% per year. Doctors use a risk model. If your M protein is over 1.5 GDL, or it's a non-IgG type, like IgA or IgM, or your light chain ratio is abnormal. Each of these increases risk. Low-risk patients have only about a 5% chance of progression over 20 years. High-risk patients may face up to 58% risk over 20 years. At diagnosis, doctors usually do blood tests, CBC, kidney function, calcium, immunoglobulin levels, and a free light chain test. Urine tests if needed. Sometimes bone marrow biopsy or imaging if there are risk factors or suspicious symptoms. For follow-up, low-risk MGUS, recheck at 6 months, then every 2-3 years. Higher-risk MGUS every 6-12 months. Doctors look for rising protein levels or new problems like anemia, kidney trouble, or bone pain. MGUS usually has no symptoms, but if it progresses, warning signs include bone pain, fatigue from anemia, kidney problems, repeated infections, weight loss. Any of these should trigger a full recheck. There's no treatment needed for MGUS itself. The strategy is watchful monitoring. The good news? Most people with MGUS never develop cancer. With regular follow-up, doctors can catch any changes early. To sum up, MGUS is a condition with abnormal proteins in the blood. It isn't cancer, but it carries a small risk of progression. Diagnosis follows strict criteria, and management is all about careful monitoring. If you found this video helpful, please like, share, and subscribe for more clear, guideline-based medical explanations.